Contraception is the deliberate use of artificial methods or other techniques to prevent pregnancy while in the act of sexual intercourse. 5 reasons one should use contraceptives. First is they help protect against unwanted pregnancies. Second is condoms and other barrier methods help protect against STDs. Third is birth control pills have been shown to reduce the pain of periods and regulate them in terms of when they happen. Fourth is birth control pills have also been shown to reduce the chances of vaginal cancer and breast cancer. Fifth and finally is birth control has also been shown to improve skin condition. The first and foremost effective form of birth control is sterilization. Without becoming sterile, there is an implantable rod, injection, an intrauterine device. Abstinence is the practice of restraining oneself before having sexual intercourse, either for an indefinite period of time or till a certain requirement has been met. This is often used in the case of no sex before marriage. A condom is a barrier contraceptive that stops semen from reaching the woman's body. For correct use, you'll pull it over the male penis and leave it on during sex, so it can stop the semen from releasing into the vagina. Common mistakes are usually people thinking you can use it more than one time and that they have no expiration date. Cons of a condom are that if it fails, you get a surprise baby and a wasted small amount of money on a condom. In the case that the condom is free, the only negative surprise would be a baby. Positives are that it has lubrication to make sex smoother, and in the case of oral sex, they can come in flavors to make it more pleasant for the giver of oral. The obvious positive is that it stops pregnancy more often than not and helps block the transmission of STDs. It has a 12% failure rate. The female condom is a barrier contraceptive which is placed inside the vagina and can be placed inside for up to 8 hours before sex. Negative side effects may include vaginal pains, incorrect usage leading to it getting stuck, buildup of bacteria and fluids if left in too long, and or failure of correct usage leading to pregnancy. Positive would be that it might stop pregnancy and helps protect against STDs, but honestly, if you're doing this to stop semen from getting into your vagina, having the male condom is a much more effective and much less of a pain to do. It has a 21% failure rate. Spermicide is a barrier. Spermicides are contraceptive and can be placed into the vagina for an hour or less before sex. When sperm enters the vagina, it attempts to kill them and can be used with a condom as a backup security just in case. Has a 28% failure rate on its own, and with another tool, failure rate is lowered by most likely lower than 10% based on compatible contraceptive tools. Birth control pills are orally ingested hormonal contraceptives. They may cause hormonal imbalance and or mood swings. Positives of this are having a lower pregnancy rate and in some cases have been shown to improve skin condition, lower period pain, and regulate schedules of periods, and reduce the chances of developing breast and vaginal cancers. It has a 9% failure rate.